Wow. Welcome back. Good evening, good morning, good afternoon, good evening. Namaskar. Welcome back to the second half year of 3-year path education. Still, we are in the first year, second half. Hope and believe that you had a good time as a vacation, or maybe many of us had not vacation at all. Always, most of people were here. Good. By any chance, if someone wants to share something, some experience you may have applied, or you may have suggested this information, your knowledge, to any of your friends, contacts, clients, and you may have seen, or you may have the good, positive, or negative, whatever, some experience. Maybe someone wants to share it. Yes, yes, and yeah.
I look at my whole world now like as an Ayurvedic being. Like I feel like I feel like we're just getting started. I'm excited for the herbs to see how that even more, but I'm feeling so much more connected with nature and seeing the world so differently from after this first part. And I share, with all my clients. Some people I have, different responses, all the way from like, some people are like, mung bean, like, what are you talking about? Like, they act like even just the mung bean is something scary. Other people are like, curious. And then other people, you can tell they've just been like waiting. There's got to be something else out there, And even if I give somebody the book a year ago, I've noticed that I can't be attached in any way to if they read it right away, or if they if they used it, if they made the soup once or 10 times, or if they were giving it to other people. Like, of course, in my mind, I wanted everybody to be like, oh, and be like me, telling everyone about it and doing everything, and would act like even wounded, if someone hadn't read the book yet, or made mung bean soup. And then, but as I'm adjusting my diet and I'm seeing my reactions change and even my perceptions change, I'm almost my own observation. It's almost proving to me that it works. I'm my own success story. It feels like I don't react even remotely like I used to like emergencies, like the well pump went the other day. And like I have like a minute now compared to like what would be hours of reaction. And I think I still have like these minutes so I can laugh at myself, and I can compare, because it's, I realize what I've been doing to my physiology, by every single thing being so critical. And I guess that was the pitta, and the vata together, making things just so, I don't know, my emotions could just last for a long time, and they could be in high volume, and I just love that I'm more even keeled. And I'm just really happy. I'm happy that we're back together and that I get to learn more, because I feel like there's so much more. And then that makes me want to be on the planet to learn more and offer more. Like, I felt like I had gotten to a little stagnation period and felt like, did I waste my life? Is there anything else more for me? And this gave me more. So that I'm grateful. Thank you.
And you made a big statement. Before and after this experience, may change in your perception. It's a big word, big statement, changing in the own perception. What you were thinking before and now, just, and maybe if you can note down your today's perception, experience, and understanding after 3 months or 6 months, again you review it, it will be reprint with more and more deeper understanding, more and more experience, own experience and applied experience. It will keep on changing. It will help to boost your confidence. Great statement. Wonderful observation. Nice. Thank you. It's very inspiring. Nice. Yes, Pilar.
Hello to everybody. I just want to share with you what happened to me 3 hours ago. I was coming back to my house by bicycle, and suddenly in front of me, a lady fell over from the bicycle, a big accident, very hit, a crash on the floor, and two people stopped there and intend to help her. And because I saw so many people there, I decided not to stop and to continue, because I don't want to be too crowded around. And suddenly I thought, in my mind came and say, but they don't know what you know. But they don't know what you know, and you help in another way. And the most important thing now is the emotion. Go. And then I go back with my bike, went there and starting to applying to her the marmas. And because she was in a panic, you know, in a panic attack, because it was so very very incredible accident. And then I started to apply the breathing exercises and marmas and everything. And she immediately, in a few seconds, she started to become calm. And because she was becoming calm, she could breathe and she could stay up a little bit, and I can talk to her. I check and see that she hasn't got any bone broken. And suddenly she said, who are you? Why you know this? What? And then we start to talking, and she forgot the accident, and I teach her how to apply by herself to support herself with the trauma and the shock of the bicycle. And I telling you, in 10 minutes she was walking again, and she was around 60 years old. She wasn't a young lady, you know, she was like a 60 or more than 60. And in 10 minutes, she was able to, not to by bicycle, because I recommend her not to be by bicycle, but she was start walking and walking with her husband to her house. And they were her husband was a doctor, an eyes doctor, and he was very surprised how I treat her husband, his wife, sorry, and how immediately she came back alive again, and still nervous, but a little bit, you know. And they want to know, they take my telephone, my address, and because they want to know more about this medicine and everything I do, and was so incredible, you know, that now we got tools, we got a lot tools that many people doesn't know at all, even if they are doctors or whatever, no, and we can apply that. And yesterday in the home care of my mom, one of the woman living there was with dementia, and she was in a very panic attack because her son was visiting, but she didn't want to, the son went. She wanted to go with him because she didn't want to stay in the home care. And she was in very aggressive, very, you cannot believe it, the aggressivity. And the son was there 2 hours and she couldn't escape at all. And then after I left my mom, I said, okay, I'm going to help. And I started doing this to her. All the points, she was very aggressive, said, no. And then I realized, no, I'm going to do it to your son. and I started to do it to her son. And she said, he's doing to her. And said, now your son, now you, now your son, now you, different points. And then this become a little bit calm, and the son could escape like a fire, you know. And then I can say that she became very aggressive. We have to support the door because she wanted to go. And even he bite me in my arm. Imagine the level of aggressivity. She bite me very strongly in my arm, but the son could go. And after that, I start again in her. I went with her on the patio. We went there, apply again, and in 20 minutes, she went perfect. And the son was more than 2 hours there, not being able to leave the home care. And everybody, the nurse telling me, you know what I'm gonna do? I'm gonna put it in an injection to calm her down, and for the son to leave, because it was the son and the son of the son, the grandson that was living all this horrible experience, seeing very aggressive to the grandmother, you know. And more than 2 hours there, all stuck. Everybody, no doctor, no nurse, nobody could manage to do anything, you know. And I couldn't do nothing because I was with my mom. But as soon as I leave my mom, I start doing it. And it was great, that idea of no approaching to her, because when I approach to her, immediately she knows that I'm going to do something to her. She didn't want to, but I got the idea to do it to her son. And then she wanted, because I did to her son, then to her. And that was the point, that this poor boy could leave the home care stuck there for more than 2 hours, and he couldn't leave. And it's amazing. I think we got a very, very incredible tools that we can apply in any situations.
Wow. Wow. Both of these experiences are amazing. Great. The experience which you said you had 3 hours before, just with small thought that what you know, they don't know.
Yeah, exactly.
My
Exactly.
goodness.
That is very
And
important.
that one small thought helped that woman a lot. We don't know. Otherwise, that woman would maybe in the more sufferings and maybe need to go to hospital or clinics and sit meeting doctors. But just simple help. And also the right time, right thought and idea and tool you can think about is also very important. When you are in the hospital, in home care center, and again you thought about, it's very important to use. And this way we can help and we can understand the power of these different tools. How big help it is. The simple marma or simple things, emotional touch, some simple words also can make a big difference. Wow, great.
Yes, because the lady in the bicycle, she immediately started to feeling better. And after that, the 6 point in the arm to get support from the shock, the emotional shock. She said, wow, I feel it enormously. She said, I feel it enormously. And I said, please repeat it during the day. Say, yeah, I'm going to do it, because really cut my mind from the accident. It's incredible.
Yes, thank you, Pilar, for sharing this. Yes, Afsane.
Namaskar. Hi. Thank you so much. I just want to share something that happened during summer. Now, this bag that you see goes everywhere with me. And inside is all the remedies that Dr. Naram used to carry with him. Includes the turmeric, the garlic, the ghee, and many other things. And I have an ear drop, as you know, the dropper as well. And all the things that Dr. Naram used to have in his bag, and Jaggery as well. And when I was on holiday, I slipped on a very hard ground. I don't know what it's called, but I slipped and I cut my knee open. And but because we were out, I just managed to put some water on it. And I suddenly remembered this, and I started putting turmeric because it was burning like crazy and it was bleeding a lot. And within seconds of putting turmeric, and I've tried turmeric many, many times, because I cut my hands and I do lots of gardening. So that was one thing. Another thing was my mom is 87 years young, and whilst on holiday, her heart rate started falling, and we were by the seaside, and you know, the panic moment came, and it was very sad because I was crying, and I just, for 1 second, I really thought we're going to lose my mom. And I just went, oh, Dr. Naram, what would I do? What would I do? Then suddenly I remembered ajwain and ginger powder to rub it on her feet and her hands. And I got my sister and her husband to rub her feet, and I was rubbing her hands, and we were talking to her kind words, you know, like, Mom, I love you, you know, and I was monitoring her heart rate. Nothing was happening for the first, I don't know, every second seemed to be very, very long for me, you know, but it wasn't more than a few minutes that her heart rate started going up. And I just thought I need to share this because knowing that by rubbing ajwain and ginger, you're increasing the circulation. Am I correct, Dr. Rama? And
Yes,
that
yes.
makes the blood go round faster, obviously, and it raises the heartbeat and the blood going round, which is important for oxygen levels, etc. And when we went to hospital, because we had called for the ambulance in the meantime, they saw me still rubbing this ginger and ajwain, and the doctor looked at me, said, "Oh, you are into witchcraft." I said, actually, it's called Siddha Vida, it's called Ayurveda. And I had the book with me. So I said, it's sad that I don't have the Turkish version, but I'm going to gift you my English book. And I gave him my number, and he just emailed me to say that he's finding what I was doing with my mom very fascinating. So he has promised to let me know when he's convenient, so I can perhaps connect him to one of the ideas, but I don't know if he will contact or not, because my Istanbul Turkish is not that great. So I was speaking in Turkish with him. And I think we should all really carry this. This has been a lifesaver. Oh. Another thing that I took with me was a year's supply of herbs for my mom, and also six bottles of Astalok, and 6 bottles of Immuno, 6 bottles of Diviro, 6 bottles of Divisia's Jivan. And funny enough, we all got COVID on return. And I was so grateful to have the herbs, and of course the immunity tea that we were drinking even in Turkey. I was making it on a daily basis, maybe once, but I was making it. And I really believe that because my COVID turned into pneumonia, and the doctors wanted to put me on antibiotics. And I thought, I'm not going to take antibiotics because antibiotics would weaken my immunity. This is what I've learned through my lessons. So I didn't. Instead, I increased my, all the herbs that I was taking, I just increased them, the Diviro, the Immuno, the Astalok, and the just was G1. And these are, I really believe that they helped me, and also Lipton, because I was thinking I want to detox my liver, blood goes through the liver, and the virus is going to be carried. I just increased it by crazy, like I was taking 444 and I knew that nothing happened. The symptoms were very mild, given that my mom is very elderly, and I immediately asked her to take these herbs and stop the other herbs that she was taking, because she couldn't manage taking everything. So I am going to recommend, with your permission, that everybody please have in your house the Viro, Immuno, Astalo, this was G1, and Livtone, even Rejulive, which rejuvenates liver. Have it in abundance in your house, so if somebody needs it, you can give it to them. One bottle is not going to be enough, because you're going to take 4, 4, 4, 4 for a few days, and then maybe 3, 3, 3. Mind you, I've been taking 4, 4, 4 for about 3 weeks now, without taking any antibiotic. My severe pneumonia, because I have COPD, actually, without taking any antibiotics, it has cleared a lot. So I'm very grateful to Dr. Naram, to all the doctors here, Dr. Clint in particular, who introduced me, and to Dr. Kumar for teaching me so beautifully, and all the doctors of Shakti, and Dr. Smita and Krishna. Thank you all.
Great, great, Apsana. Wonderful experience and good idea of carrying this ajwain and dry ginger powder along with you. It's a great idea.
It is important, very, very important. And also the garlic with the sugar, the jaggery. Very, very important if somebody is having heart problem. I've already taught the heart marma to my mom, and she does it every day anyway, but I was trying to do it for her just in case. And also I did put I quickly just peeled garlic. You have no idea how my hands were shaking, but the feeling that I was able to do something was tremendously amazing. I mean, that's my mom, you know. I was so grateful. I actually, at the end, I was sitting there crying, and I was just saying, thank you, Dr. Naram, thank you, the lineage, thank you, all the doctors, thank you, God, for putting me in this path. I put some ajwain together with garlic, and I kept putting it in her mouth and saying, chew it. And she was like, this the heart very bitter. I said, just chew it and swallow it, just swallow it. Just chew and swallow it. I did 2 garlics like that. And I know Dr. Naram did this to Dr. Giovanni, and it worked. So thank you.
Nice, nice, nice. Yes, it is very much true that this massage with ajwain and dry ginger powder on the foot sole and the palm, both sides, helping a lot. We have many experience. People were in the coma, people in the last moment. At least we can extend some, we can improve some circulation. And if there is some blessings, definitely there will be a good positive experience, positive change. Being a doctors, again, we can improve the quality of life. We cannot increase the quantity of life. It's all beyond our hand and capacity. We can improve, we can give, we can do all what we can do the best. But great experience, great idea to keep it with us always. Nice. Thank you. Yeah. Any questions, any settings, anything anyone wants to? Yes, Dr. Sanjay. Yes.
Yes, I just wanted to share about the Healthy Me Detox. I was fortunate enough to finish it recently. And it's been a good experience. It's more decisive for me comparing this treatment versus the moon treatment that was talked about in the 100-day course. And the effects are more decisive. And healthy detox is much more detailed, of course, more detail oriented, and you have to really get at it every day. But I found that now, having taken the course this few months, that I understand it better as a student. I'm less afraid of healthy meat detox therapy or treatment, and the effect is better than the therapy talked about in the 100-day course.
Wow. Wow. Wonderful sharing again. Like the same thing was done earlier and now, just with more understanding and knowledge. When you are doing with more confidence and better way, all implementation. So you get the good results. Nice, nice. That is what. And maybe after a year or 6 months, when you do third time, maybe you will have more deeper and better experience. Yes. Good, good. Thank you. It's motivating. Nice sharing. Thank you. Yes, Susie.
Namaskar. So
Namaskar.
I have a personal story. You know,
Yeah.
I've been on this path for 2 years, and it's taken me 2 years to get to zero pain. I have no pain in my body.
Wow. Nice, nice, wonderful.
I have my life back. I still have to work on my strength and endurance because I'm out of shape. And the weight is coming off slowly, but the fact that I have zero pain in my body is the greatest gift. I've been in pain since 2013. And in 2019, I was in a wheelchair because it got so bad. So thank you. That's all I want to share.
My goodness. From many years. You are suffering, and then now you relieved from this pain and suffering is only because of your trust, your faith in this Siddha Veda. It's only because of your committed and dedicated efforts. Without losing hope. You are following for the last 2 years. And that is the reason. That is why you got the result ultimately.
And I'm so grateful to you, Dr. Hamam, and all the teachers here, and to Anne for introducing me to this amazing system, and to Saima, and to Dr. Naram and Dr. Smita, and Baba Ram Das and Viveka, because they have changed my life. I'm so thankful.
Thank you. Thank you for sharing this. This is a great, great example that the Siddha Veda can be helpful for any situation, any condition. And we can share this type of example with our clients, friends, contacts. This is possible. No need of taking antibiotics in COVID, no need to take the painkillers in this pain condition. Without that, Siddha Veda can help. It needs only the trust, confidence. Right. Great. Thank you. So now, well, coming back to the main education. As all of you know, that now onwards, from this September onwards, we are going to talk and discuss more about the supplements. Detailed information, explanation about the all different type of herbal remedies. We will talk in the detail what are the ingredients in the different herbal remedies, how they work, when to choose and when to select which supplements exactly. There are the similar type of many different remedies like a Suniram or skin tone, Asthalok and Divyaswas, Diabar and Sugarid, Sandhi Yog, Pain Mukti MJ, Rasnadi, Google, like a similar for one simple condition. There are the multiple herbs, multiple remedies. Then which remedy is right for that moment? How to decide, how to select? We will understand everything in the detail. But before that, we need to understand how these herbal remedies are working, functioning, acting. Of course, because the different ingredients inside. But how these ingredients are working based on their different properties. Which properties are there? Which properties, about which property we need to think and check and understand. There are the different qualities, parameters that we need to think about before selection of any herbal supplements or recommending. So today in this sessions and the next session, these two sessions will be only focused to these properties, different type of the properties of each ingredient, which properties we are looking for. So basic, fundamentals, foundations, actual. Okay, then we will, from the next month, means October, we will start talking about the herbal remedies. So in this month, we will talk only the basics, fundamentals. These two sessions are very important. Please don't miss. Otherwise, the next month, when we will talk about the herbal remedies, it's difficult to understand. There will be so many questions, otherwise always confusion. Why this, why that? If we will understand nicely, perfectly, deeply these two sessions about the properties, then everything will be very easy. From this month, from September onwards now, we will have always two sessions every month. First Saturday and third Saturday. First and third Saturday of every month. So we will have this other Saturdays off for the study or other, like watching the replay again or whatever. We will have the education session 2 times in a month. The full calendar is already shared in the group, and also it's there in the portal. Before handing over this to Dr. Komal, for a 1 minute only, I show you the, let me show you this platform where maybe sometimes you have some difficulties. Here, when you log in your portal, education portal, you may see this first, this type of the block, okay, your course package here. So first of all, we need to click here. Then when we go inside, here it's written as a select the subject on the right, on the left side here. And here is the arrow button. Now, earlier, by default, here it was like this. Okay. It was like the subject as a 3-year path session. Okay. Content wise. Now, you can see here, still you can keep on changing, okay, anytime. You are able to change it. Because right now we are talking about the herbs and herbal remedies. Now it is set as herbs and herbal remedies. Earlier it was more about the basics of Ayurveda, and then the pulse, and then different sessions. But now, since we are talking about the herbs and herbal remedies, we have, by default, you will be able to see this, but you can change it anytime. Wherever you want to go, you can go. And you can have all the sessions here. Everything is available here subject-wise. All the repeat sessions which we had in the vacation period are here. All sessions are here, each and every sessions, okay? So you can always change it according your requirement. All 3 years path sessions content session wise, from the beginning to until now, you will always find it here. Okay. This is the one main folder where we put always as a session wise 1, 2, 3, 4, 5. All the different type of the subjects are mixed, whether it's a basics of Ayurveda or pulse or herbal remedies or marma. You can find it everything here in one common folder when you read it as a path content session wise. But at the same time, some people want to study at a time only one thing, then you can still check it only basics of Ayurveda. Then you have only the basics of Ayurveda. Only herbal remedies, only herbal remedies. Here we have the all ingredients, some of the like contents from our India visit, factory visit, forest visit, and then we had one workshop on 30th March. Those details are already here. And then time to time we will upload further details. I believe this is clear to everyone. If any questions, feel free to ask. Okay. All the ingredients are, all the contents are there. And like before, again, we will always on the Friday or one day before the session, we will upload the study material on the portal. And the next day we will upload the assessment. Again, we will have the assessment for every session. If anyone has still need to complete the assessment from the previous 6 months, and if anyone needs any special help, we are very open and available, and we will be very happy to give you the personal meeting. We can schedule the personal meeting 1-to-1 for anyone and with anyone if you need any explanation. Okay. And now onwards, again, we request you time to time, if possible, complete these assessments so it will be easy for further. Thank you I invite Dr. Komal and Cornelia to take over, and please. Thank you.
Namaskar, everyone. So good to see all of you again. Spare me today because I have a little sour throat. So little my voice is not up to the mark. So we will start with the session. And as Dr. Hemang has explained, that we are going to learn about the herbs and the herbal remedies. So listening to the experiences shared by all of you, even your experiences will still become, enriched, because this is now the gist of the science that we are going to start. So as he has told, that please concentrate and feel free to ask whatever questions are there. So likewise, so we will start with our session, and we will start with our prayer first, and then धन्वन्तरे गरुचि धन्वन्तरे ऋतरु धन्वन्तरे भवसुधा भान्वन्तरावसथ मन्वन्तराधिकृत तन्वन्तरौषधनिधि धन्वन्तरङ्गशुभु धन्वन्तमादिषु अवितन्वमापितनया सुन्वन्तकात्मरुद तन्वन्तरावयव तन्वन्तरात्रिजलधौ ॐ चन्द्रौगकार्तिममृतात्मतरै जगन्ति सञ्जीवयन्तममितात्मसुखं परेशम् ज्ञानं सुधाकलशमेव च सन्दधानं शीतांशुमण्डलगतं स्मरतात्मसंस्था अज्ञानदुःखभयरोगमहाविषाणि योगो यमाशु विनिहन्ति सुखं च दद्यात् यन्मादविभ्रमहर परतश्च सान्द्र स्वानन्दमेव पदमापयति स्म नित्यम् ॐ श्री धन्वन्तरये नमः. Yes. So with that, after seeking blessings of Baba Ramdas ji, the Siddhaveda lineage, Pankaj sir, Smita madam, all the great masters, and my guru Sadguru Veda Bharti Maharaj, I start with today's session. Yes. Next slide, please. So we are going to learn in this session today about the substances, that is Dravya. As I told you, this is the gist of the science of Ayurveda and Siddhaveda. Because now we are directly dealing with the herbs. Now we are directly dealing with the medicines. Till now, we have been learning about the principles of healing, and which are very essential. And now every one of you is working so hard. And even in the revision sessions also, I hope everybody is now aware with the principles of healing. Now we are directly going to deal with the substances that are used for healing. What are the different types of what we call as medicines that are used for healing? It can be herbs, it can be even the food, the diet, everything. So when we say that this is the herb that has cured, for example, guduchi, the herb, it helps in fever. So why this herb guduchi, why it helps to cure fever, why it helps to subside fever? What are the properties, unique properties that it has? So all this knowledge we are going to study. Then, so that is Dravya. Dravya means the substance as a whole. Then second point is taste, that is Rasa. So Rasa, everybody now knows Rasa is of 6 types. That is the sweet, sour, salty, pungent, astringent, and bitter. The 6 types of Rasa. Then another concept is potency, that is the virya, that we are going to learn, and post-digestive effect, that is vipaka. And again, a very important concept, which again explains us so many things which are still, by some point they remain unanswered. So those things also can be explained by this last point, that is the unreasonable effect prabha. So we are going to learn again all these points. Next slide, please. Yes. So here is a Sanskrit verse that explains the substances, that is the dravya. Yatrashritaha karma gunaha karanam samavai yat tad dravyam. So this is a Sanskrit verse that explains that dravya or substances are those where the karma, that is the actions, and the guna, that is the qualities, are located. In the background, you can see various herbs. Okay. So when we say these herbs are healing, why they are healing? Because they have certain actions and qualities in them. That's why they are healing. So substances are those which contain or which are made up of the actions and qualities. And that's why this is the beauty of Ayurveda and Siddha, that there is no substance or dravya on this earth that is not medicinal. Everything is medicinal because it has certain actions and it has certain qualities. The only thing is we should be aware of how it is working, what is its action, whether it is beneficial for the human body or not, and what are the qualities. And this we are going to learn further in the coming sessions. Sorry. Yeah, next slide. So dravya is a combination of karma and guna. That is, action plus qualities is equal to substances, means dravya. So just fit this in your mind. This is another very important equation, that is action plus qualities is equal to the substances. So when we say different kinds of substances or dravya, the two things that should come to your mind is the action and the qualities. Yeah, next slide. Now, types of substances. So again, there is another Sanskrit verse. Kinchit dosha prashamana, kinchit dhatu pradushanam, swasthvritam matam kinchit trividham dravyam uchyate. So dravyas are of three types. Some dravyas or substances, they pacify the increased dosha dhatu and malas. Some of them, they vitiate the dosha dhatu and mala. And some of them, they help in maintaining the health of the body. So these are the three types of substances. Some that help in pacifying the increased dosh dhatu and mala. Some that vitiate the dosh dhatu and mala. And the third type that help in maintaining the health of the body. So we are going to learn about all these three substances. Now see the first type of substances, the dravyas that dravyas that pacify the increased dosh dhatu and mala. They are the medicines. They can be used as medicines for healing. The second type, that is the dravyas that vitiate the dosh dhatu and malas. They are the causative factors of certain disorders. The disorders, they are caused due to the wrong dietary habits and lifestyle and everything. So that our second type is that dravyas which produce certain disorders. And third type of substances or dravyas are which prevent the occurrence of the disorders. That means they maintain the health of the body. So understand, just a second, that dravyas are of three types: to pacify the increased dosh dhatu and malas. Then second is the dravyas that vitiate the dosh dhatu and malas. And third is the dravyas that maintain the health of the body. Next slide, please. So now we will move towards taste, that is rasa, the post-digestive effect, that is vipak, and potency, that is virya. रसोनिपाते द्रव्याणां विपाक कर्मनिष्ठया वीर्यं यावद् अधिवासात् सन्निपातात् चोपलभ्यते. So taste or rasa is known after the contact of a dravya with the sensory organ tongue. So we all know this. How do we perceive the taste or rasa? After that particular substance comes in contact with the tongue. Then the post-digestive effect, that is the vipak, it is known by the observing the final effect on the body. I have explained this earlier also in the education week, that the original rasa of the substance before it goes inside the body, the original nature or rasa of a substance, okay, that we come to know after we taste it by the tongue. Then after tasting it by the tongue, when we swallow it, it goes inside the body. When it goes inside the stomach and the process of digestion takes place, then that post-digestive effect, after that digestion, the post-digestive effect is called as vipaka, where the original rasa or taste is transformed into three types of rasa, that is the sweet, the sour, and the pungent. So vipak is of three types, that is the sweet, sour, and pungent, that we are going to study in this slide only ahead. And then potency, virya, is known by the action exerted from the period of administration until excretion. So till the time the herb remains in the body, what is the certain action that it is exhibiting, that is called as potency or virya. Like some herbs, they have cooling effect, some have a hot effect, some are they increase the vata pitta curve, some they decrease the vata pitta curve, like that. So they have, every herb has a certain action. Some are, good for the heart, some are good for the kidneys, some are good for the liver, like that. So they have certain actions, and then that action is known by the potency or virya of the substance. So again, I will tell you that rasa, that is the taste, is known after the dravya comes in contact with the tongue. Okay, just tasting it by the tongue, that is rasa. We know the rasa by the tongue only. Then vipaka is the post-digestive effect, which is known after the substance it goes inside the body, the digestion process takes place, and then it is transformed into three types of rasas. And the third is potency, that is virya, which is known by the action of that particular substance. Next slide, please. So yeah, it is very nicely given here and good for the visual memory, that is dravya. It is composed, means it contains the rasa, virya, vipak, and prabha. So whenever we say dravya or substance, the four things that should come to your mind is rasa, the taste, virya, the potency, vipak, the post-digestive effect, prabha, the unreasonable effect. Next slide, please. Yes. So this is a case study of regarding rasa. We can see this is a recently shared case. I think everybody must have seen it. So this client, Samir, we can see in the first picture, due to excessive consumption of sweet or madhura ras, there was weight gain. So we all know that sweet taste, it increases which dosh? It increases the kapha dosh. And kapha dosh is composed of which elements? The water and the earth element. So water and earth element, because they are heavy, they tend to increase the weight. They tend to increase the overall volume of the body. So someone, when excessively consumes the sweet taste, then it leads to weight gain or obesity or increase of kapha dosh, like that. So in this picture, the before picture, the first picture and the second picture. So this client had followed the healthy meat detox, and after that, these are the changes we can see even in the complexion, the weight and everything. It is seen. So very good change. So this is a very good case study. Next slide, please. Types of taste. So there are 6 types of rasas. Sweet, that is madhur. Sour, that is amla. Salty, that is lavar. Pungent, that is katu. Bitter, that is tikta. Astringent, that is kashay. So everybody knows this, the 6 types of taste. Okay, next slide. So this is something that everybody should remember very well. Write it down and remember, because this is the further studies are based on this, and this is the essence of the herbs and everything. So see, in the first column, the vat pitta kapha dosh, it is given. In the middle column, pacifying rasas. So the rasas that pacify the vata dosh, they are sweet, that is madhur. Sour, that is amla. Salty, that is lavar. Keep this in mind, okay? Sweet, sour, and salty, they pacify the vata dosh. Then pungent, katu, pungent means katu, bitter, tikta, astringent, kashay, they vitiate the vata dosh. If you don't remember the Sanskrit names, that is okay, but at least remember that pungent, bitter, astringent, they vitiate the vata dosh. Now I will tell you how to remember this. Now from vata dosh, directly go to kapha dosh. See third number kapha dosh. There you can see that pungent, bitter, and astringent, they pacify the kapha dosh, and sweet, sour, and salty, they vitiate the kapha dosh. So it is exactly reverse. So this is very easy to remember. Just remember that for one, for you remember either for vat or for kapha, and remember that for the other type it is reverse. Okay, so for kapha dosh, pungent, bitter, astringent are pacifying, sweet, sour, salty are vitiating. For vata dosh, it is reverse. For the sweet, sour, salty are pacifying, and pungent, bitter, astringent are vitiating. Then for pitta dosh only you will have to remember is the pacifying rasas are astringent, sweet, and bitter, and the vitiating rasas are pungent, sour, and salty. Okay, so remember it this way. Anyhow, even if you have another technique, you can share with everyone afterwards and then remember, but remember it by writing it down. Okay, next slide. So can you just guess the taste of this substances? The first one, the garlic and the mung beans. So garlic.
Is garlic astringent?
Pungent.
Yeah, pungent, right? Little
it
bit
pungent?
of astringent also. Little bit of astringent also, mainly pungent. Yes, mung beans.
Sweet.
Yeah, sweet and
Astringent.
yeah, sweet and astringent, right? A little bit of bitter. Okay, but the main rasas are sweet and astringent. Okay, next slide. Next slide, please. Yeah, so again, cow's ghee. What do you think must be the rasa of cow's ghee?
Sweet.
Very good. Very good. And the celery. Everyone knows celery.
Astringent.
Pungent.
Astringent.
Pungent, bitter.
Celery.
Yeah, astringent, bitter, and even little bit of pungent.
Bitter.
Right. Next slide, please. Case study of the post-digestive effect, that is Vipak. So actually, this time we are going in this way, that first we are seeing the case study and then we are going towards the concept. So first we will see this case study of Vipak. So here is a client named Karan. He suffered from urticaria hives for 8 years, and he tried many treatments before but didn't have any long-lasting results. So he was basically suffering from urticaria hives. Everybody knows about this, and it was really very chronic, as he was suffering from it, from 8 years. Then when he came to Ayush Shakti, he was examined, and the Ayush Shakti Vaidyas, they discovered that he used to drink orange juice daily. Now tell me, what is the rasa of orange juice?
Sour.
What is sour?
Sweet,
Yes.
sour, bitter.
Yeah, but basically the main is sour. Okay. So according to Ayurveda, the oranges have amla vipak. That is this. It has a sour post-digestive effect. Now, why it has sour post-digestive effect, I will explain. So he was advised to have Indian gooseberry instead of oranges. So amla has madhur vipak, a sweet post-digestive effect. So amla, everybody knows that the Indian gooseberry. And the speciality of the Indian gooseberry is that it has all the taste except the salty taste. Except the salty taste, amla or Indian gooseberry contains all the other tastes. So, and it has a madhur vipak, that is, it has a sweet post-digestive effect, and that's why it is very beneficial. So he was advised to take that Indian gooseberry instead of the oranges, and he followed that, whatever was suggested. And he also was recommended detox plan, herbal remedies, and diet plan. And he followed everything as suggested in the first month, he had 50% improvement. He continued to follow his treatment plan, and after 9 months, he had no recurrence of urticaria. Now, if we try to understand this case, see, first of all, urticaria. What is urticaria? Which kind of disease it is? Skin disorder, right?
Pitta.
Yeah.
Pitta related.
Which dhatu?
Rakta dhatu.
Rakta dhatu. Okay. So, and right now we saw that pitta gets vitiated by which three rasas?
Sour.
Sour, salty, and pungent. Right now,
So anything that is acidic.
Yeah, anything that is acidic, sour, salty, and pungent. So he was suffering from urticaria. Still, he was taking the sour things, and that was even aggravating the condition. So it is very essential to first find out the positive factor and exclude it, so that there are good results. Otherwise, what happens is we give the right kind of treatment. Everything is right. But if that cause is not avoided, because of which that disease is caused, then it takes longer time to heal. So in this case, that was diagnosed and that was changed. And so he had, in the first month only, very good improvement, that is 50%. And after that, when he followed the treatment plan, after 9 months, he had no recurrence of urticaria. So understand from this case, now you are able to understand, looking at the case, that what is the dosh, what is the dhatu, then what is now we have to go one step further, and you have to understand about the rasa, vipak, and everything. That will come to you gradually. Okay, this is only the first session. So don't worry, it will come to you gradually. Next slide, please. Now see, now we will study what is the post-digestive effect, that is vipak. Now I told you, vipak is the transformation of the 6 types of rasas: the sweet, sour, salty, bitter, pungent, and astringent, the 6 types of rasas. They get transformed into 3 specific types of rasas after they come into contact with the dravyas containing the 6 rasas with the digestive fire. So these three types of vipak are, see here in the slide, 1, 2, 3, sweet, that is madhur, sour, that is amla, and pungent, that is katu. Okay, so sweet, madhur, sour, amla, pungent, katu. So tell me, which are the three types of vipak, everyone? Sweet, sour, and pungent. Fix it in your mind. Huh? Okay. Next slide, please. Yeah. Now see here. We will study even what this vipak does. Okay. So see, sweet vipak, it has a anabolic action. So it will tend to increase the kapha dosh. Sour vipak, it has a metabolic activity which will have an increased effect on the pitta dosh. And pungent vipak, it will have a catabolic action. It will increase the vata dosh. We will study this, don't worry. Next slide. See, in this slide, it will be more clear. See, three types of vipak are given in the column 1, 2, 3. Okay, sweet, sour, pungent. So see what sweet vipak does, it is that it helps in elimination of feces and urine. That means if there is some problem regarding obstruction of feces and urine, then we should use substances that have sweet vipak, There is a difference between sweet taste and sweet post-digestive effect, that is vipak. Okay, so the sweet vipak will help in elimination of the feces and urine. And at the same time, it will also help to increase the kapha dosh and the semen. Now, semen, everybody knows the shukra dhatu. In Ayurveda, we relate it to shukra dhatu. Just keep this in mind, then I will explain to you gradually. Second, sour. So, sour vipak, that is amla. It also helps in elimination of feces and urine, but it increases or aggravates the pitta dosh. And it has a little, it is written here, produces semen. It is not like that. It has a little harmful effect on the semen. Okay, that we will correct it. It has a harmful effect on the semen, sour vipak. And the third is pungent, that is katu. So it obstructs the feces and urine. Means, see, some substance, for example, substance X or substance X has a vipak, say pungent. So what it will do, it will obstruct the feces and urine. So tell me where we should use such substances which have pungent vipak, in which conditions?
Diarrhea?
Very good. Diarrhea, very good. Or, excessive urination. Okay, there we can use this herbs. And it aggravates the vata dosh.
I have one question. I understood that amla has a sweet vipak, which means it becomes sweet after digestion.
I will just appreciate if you ask the questions, afterwards, so that, we can just go in a link. Okay. So pungent also has a harmful effect on the semen. It produces semen is wrong. Actually, there is some technical mistake. It has a little harmful effect on the semen. That means the sour and pungent vipak, okay, they are not so good. Such substances are not so good for the shukra dhatu. I'm not saying they are completely harmful. They are not so good for the shukra dhatu. But sweet vipak is good for it. Understood? Then the sweet vipak, it increases the kapha dosh. The sour, it aggravates the kapha dosh. And pungent, it aggravates the vata dosh. Understood?
No.
Yeah. Next slide.
I have a question. Why is that amla under the sour vipaka? Because I heard it was making sweet. It becomes
What?
sweet after digestion. I heard that the amla becomes sweet after digestion. It's sour at the beginning, but becomes sweet after digestion.
No, I will explain that. Just wait. Okay. Next slide, please.
What do you mean by produces semen? sorry, I'm
Okay,
a little
just
confused.
go to the previous slide. Cornelia, please go to the previous slide.
Sorry. Because it's under both
The produces
pungent
semen
and
actually,
sour.
yeah, understood. Produces semen, no, instead of that, it is harmful for the semen. It is not produces. We will correct that. Okay.
Okay.
And the question I think Nushrat had asked, it is actually like this. This is about vipak. So substances that are sweet in taste and salty in taste, they get converted into the sweet vipak. Substances that are sour or amla in taste, they get converted into the amla vipak, okay, the sour vipak. And the remaining three, that is the pungent, the astringent, and the bitter taste, they get converted into the pungent vipak. Understood? I will repeat again. The sweet and the salty taste get converted or transformed into sweet vipak. The sour taste gets transformed into same sour vipak, and the bitter, pungent, and astringent, it gets transformed into the pungent vipak. Just keep this in mind. Okay. Next slide, please. So yeah, guess the post-digestive effect of this vipak dates.
Sweet.
Sweet.
Yes. And garlic.
Pungent.
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 Very good. Yes. Next. So
Sour. Tomato sour.
yeah, and millets.
I don't know what is millet.
Millet is
Well,
the
it's a grain. It's a
food
grain.
grain.
Would be slightly warming, eating,
Sweet.
No, the vipak.
pungent,
You have to just say the vipak.
Sweet.
pungent.
Sweet.
Sweet.
Yeah, sweet. Yeah. Good. Next
Are
slide.
all the beans sweet?
No. That is we have just now see, this is just like for introduction. Okay, there is still deeper. It is not like all the millets have the sweet vipak. It is not like that. It is a general thing we are doing, but we will go into the details afterwards. Okay, next
And
slide.
is mung bean, what about mung bean that we eat? What is the vipak of mung bean?
Yeah, we will go to that. Just we will complete this. Okay, next slide, please. Case study of potency, virya. So here is another case study. That is the client Nathuram. He had chronic hyperacidity, and he used to take antacids almost daily for the past 2 years. And his Ayushakti Vaidya observed that his Pitta dosh was imbalanced. So again, see, hyperacidity means Pitta dosh. Okay. And he used to have curd or buttermilk once a day to subside the acidity. But according to Ayurveda, curd and buttermilk, they have Ushna Virya, that is, they are hot in potency. Now we are going to study potency. So he was advised to stop this habit immediately, because as we know, Pitta is hot in potency. Okay. And this curd and buttermilk, because they are having hot potency, that's why his acidity problem was even increasing. The heat was even increasing because of the curd and buttermilk, because they have hot potency, and his problem of hyperacidity was also increasing because of the increased pitta dosh. So he was advised to stop this habit immediately, and he was suggested a customized detox plan, herbal remedies, and diet plan. After the first month, he had a 90% improvement, and he followed his treatment for 3 months and had no recurrence of this issue. So now see, right now we were seeing about the taste, the post-digestive effect, but we also have to see the potency of that substance. So we have to take into consideration all the things, like we have to see the taste, the post-digestive effect, the potency, as well as the prabhav. That is the fourth part, which is the unreasonable effect. So a collective efforts of all this, then we decide that yes, this substance is having this property. So it is not like if we know only the taste, then we can say that, okay, this substance is having this action. No, we also have to know the taste as well as the post-digestive effect, as well as the potency, and as well as the prabhav or unreasonable effect of that substance. And then we can say by surety that this substance has, say, for example, vat dosh increasing action or kapha dosh decreasing action, and so on. Okay, so right now we are introducing these concepts. That's why we are seeing just examples. But at the, I think at the end of May, say for at the, like till December, you will be able to understand all the things like the taste, the post-digestive effect or potency of a substance. Okay, next slide, please. Now see, the potency is, virya is the active principle or potency by which the dravya acts. There are two types of virya, that is hot potency, ushna virya, cold potency, that is shita virya. So virya is the one which is responsible for each and every action. So what is virya or potency? It is the action of that substance. And that action is, how do we know what is the action of the substance? So we see what is the potency of that substance, which is of two types. And what are those two types? Hot potency and cold potency, which is also called as ushna virya and shita virya. Again, I'm telling you, no need to get into the Sanskrit words. It is not compulsory. You just understand even the English words, hot potency and cold potency. If you can remember the Sanskrit words, it is better, but it is not essential. Okay. So potency is the active principle or the action of each and every substance. So when we say that, for example, as I told you, the example of guduchi, because guduchi, why I'm telling you is because guduchi is an excellent herb for subsiding fever. And it is one of the content of the viro also, and it helps to subside fever. So guduchi has a very good action on fever because it has the same, it has that potency. That's why. Okay, next slide, please. Potency, like hot potency and cold potency. See the columns here given. So hot potency aggravates the pitta dosh. Cold potency aggravates the vata and kapha dosh. Hot potency has a digestive action, and cold potency has an anabolic action. Hot potency can cause emaciation, and cold potency can be used as tonic. Means what? The substances that have hot potency, we can expect these three things like aggravating pitta dosh, helping in digestive action, and causing emaciation. And substances that are having cold potency, they can be expected to have aggravation of vata and kapha dosh, because we know vata and kapha dosh are also cold in potency, and anabolic action, and it can be used as tonic. Okay, means a nourishing kind of effect. Anabolic action means nourishing to the body, unlike hot potency, which is emaciating towards the body. So if we have to cause a depletion of some of the increased dosha and dhatu, so we can use the hot potency. And conditions where we have to nourish or increase the decreased dhatu or dosh, then we can use the cold potency herbs like that, or even the food items. So this is not only about the herbs, this is also about each and every food item that we eat. Because even the food items, whenever we decide what should be eaten in which disorder, that also depends upon the taste, the post-digestive effect, the action, and everything of that particular substance. So again, keep this in mind. Okay, next step. Next slide. Yeah, so guess the potency of coconut.
Cold.
Sweet.
Potency.
Cold.
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 Sorry, cold.
Yeah. And orange.
Hot.
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 Cold.
Sour. Orange sour.
Hot.
Cold.
Hot.
Oh, sorry,
Orange hot.
potency is hot.
Yeah.
Coconut is cold and orange is hot.
I'm giving you time to think.
Hot because it's sour.
Coconut is cold and orange
is hot.
Coconut is cold and orange
Coconut is hot and orange is
and hot.
We're all saying
Coconut is cold.
Coconut is?
It's cold.
Cold.
cold. Cold.
So some are saying it's hot, right?
No, it's not.
Decide.
Yes and no.
Minutes, just think. First thing,
Oranges.
don't be in a hurry to give answer. Always you
Oh.
must think for 30 seconds at least, then you give answer. Because then the answer never comes strong.
Coconut is cold.
I think coconut is hot.
Yeah, coconut can be hot.
Can be hot.
No.
Because it's cooling when you eat, so it turns into hot. Coconut is cold.
And
Peter.
oranges, we don't give
Instead
it.
of oil,
They
oil
are
is
both
hot.
cold.
Coconut is cold and oranges is hot.
No, orange is cold.
coconut is cold, orange is hot.
Oranges is cold, maybe.
Drink the juice.
Yeah,
or
orange is cold.
fresh or dried coconut.
Okay, shall I give the answer?
Yes, please.
Coconut is cold in potency and orange is hot in potency. Okay?
Yes.
First thing
Now
that we
see
see.
what is there. Every time we cannot go according to the things that we know. Sometimes it is also different. So there are some exceptions also. Like we feel that this must be hot, but actually it is cold. So like these things are there that we will study gradually. But good that you are thinking. So when we say potency, it is of two types. Which are they? Everyone, please. Which are the two types
Hot and
of
cold.
Cold and hot.
Hot and cold.
Hot and cold.
What are the three types of vipak or post-digestive effect?
Sweet, sour, and pungent.
Yeah.
Pungent.
Everybody please answer now. Huh? Everybody please unmute and answer. Huh? Tell me which are the three post-digestive effects?
Sweet,
Sweet and sour.
Sweet, sour, and pungent.
Sour
and
pungent.
Very
Pungent.
6
Sweet,
types of
sour,
rasa.
and pungent.
Good, good, good. 6 types of taste.
Sweet,
Bitter,
sour,
sour,
pungent,
sour,
Sour,
pungent,
astringent.
salty, bitter.
Bitter.
sour, salty, pungent, bitter, astringent.
Very good, very good. Excellent. You are so great. You are the future of Ayurveda and Ayurveda.
Dr. Kumar, can I ask one question, please?
Can we just keep it for the last?
Yes.
Okay, because everyone will start asking them. Eh? So we have to complete the lecture. That's why. Sorry.
Of course. Thank you.
Yeah, next slide.
Potatoes.
Okay, now tell me this. Think and tell. Potency of peanuts.
Peanuts are
Hot.
Hot.
Bad.
Peanuts hot.
potatoes are cold.
Peanut is hot and potatoes is cold.
Potatoes, I don't know.
Potatoes are cold and peanuts are hot.
Cold.
Peanuts are hot, yeah.
Peanuts hot.
Peanuts
Yeah.
hot.
Cold.
Okay.
Yes.
And
And
potatoes cold.
Cold.
Potatoes hot.
Potatoes cold.
So both are
Just
hot.
cold.
Both are hot.
so many different
Hot
answers.
and hot potatoes and
Huh?
peanuts are hot. Potatoes are
Yeah, peanuts hot and potatoes cold.
Potatoes.
That's what I think too.
Peanuts cold, potatoes hot.
Answers. Good, but you are
Hot
trying.
potato, hot
What's the
potato.
coin?
Ah, that's the answer, hot potato.
to me, they're just both bad. Not good.
Oh no. I think they're both hot.
was gonna say hot and hot.
Yeah, but they're always according to the taste. If you think of the taste and what kind of potency the taste has, then you can find the virya, right?
The peel of potato is pungent somehow, so
Cold.
The
Yeah,
matter if it's
peanut,
cooked or
peanuts
uncooked.
hot and potatoes cold.
Yes.
Cold or hot.
Peanuts hot
and potato cold.
So what's the right answer?
Well, potato has a lot of water in it, so it's cold, and peanut has a lot of fire, so it's hot.
Ah,
But there's a lot of water in oranges.
Water in it.
Arati, ask your husband, he will know, because in Iran we have hot and cold foods. Right?
I will just give the answer. Peanuts are hot, potatoes are cold. Okay.
wow.
Yeah. Next slide, please. So case study this on unreasonable effect, that is Prabhav. Can I see the next slide, please? Yeah. So yeah, come to the previous slide. Previous slide. Yeah. So now what is Prabhav? So to understand this Prabhav, we will see this case study. So you will understand it better. So that is the unreasonable effect. So here we see, what is the first picture? It is onions. Okay. Second picture, what you see?
Milk.
The middle picture?
Rain.
Rain.
So
Rain.
do you remember anything looking at this onions and milk?
Robot.
Rhubarb story in chapter 1.
Yeah.
Very good, excellent. I don't even have to explain you. Very good. Yes, we will see that. Next slide, please. So everybody has read this book. I've also read this book and I've admired Ancient Secrets of a Master Healer, written by Dr. Clint, and it is on the incredible work of Dr. Pankaj sir that we could know because of the book. So that is really nice. So in that book, we see that entire case study and remedy that can be found on page 15 in the book about Rabat, the girl Rabat, whom Pankaj sir had healed by, she was in coma, and you can read in the book because Dr. Clint has explained it in a very nice manner. So just page 15 in the book. So that home remedy was for coma, that he had cut fresh raw onion into 6 pieces and put it in a bowl and placed it on the left side of the head. Okay. And poured milk into another bowl. You can see exactly what is there in this picture. Pour milk into another bowl and placed it on the right side of the head. And the bowls were left like that while the person was unconscious. And after that, we know that she, became conscious, and everything is there in the book. So why do you think this happened? Why the onions, put here and the milk there? What did they do? How we can explain that? What taste they had? What potency they had? What post-digestive effect they had? What do you think?
Onions hot and milk cold.
Yeah.
So,
So this concept actually is one step ahead. That is, it is the unreasonable effect. That is Prabhav. It is not because of the taste or post-digestive effect or the potency of onions or milk, but it is because of the Prabhav of onions and milk that could help this person who was in coma and she became conscious. So Ayurveda even explains this concept of Prabhav, that is the unreasonable effect. Okay, that is Prabhav. So this actual case study is a very good example to understand what is Prabhav. Because here, if we try to think why onions and why they were placed, they were placed so far away from her actually. They had no body contact. The milk was placed on one side. And how could they affect, something that was not even given internally? How it could have the effect? So such things, they are called as prabhav. It is the unreasonable effect. It actually has an effect, but something that we cannot, put a logical reasoning into. So that is called as prabhav. So next slide, please.
Can Dr. Kumar?
Yeah.
But for this thing, could we say that the milk is nourishing on the left side, and the left side is the side that takes the energy, and the onion is what attracts actually bad energy. So the energy is coming away from the person's body from the right side.
Yeah, that we can explain. But still, if we try to put logical reasoning according to the taste post-digestive effect, we cannot put it like that. No, whatever you are saying, again, it is a effect, that cannot be put into the concepts like what we have studied right now, according to the concept of taste, post-digestive effect, and like that. So what I'm trying to say, you're right, that it is, having a negative, it helps to heal the negative energy and everything. But what, when we say that something is healing, the negative energy is going away, what is happening? So that what is happening is called as prabhav. Okay, next slide will explain it better. Next slide, please.
I have one quick question, because it looks as if the milk and the onions are actually on the wrong side, because it's showing from our perspective, but not of the perspective of the patient. It should be on the left side, the onions on the left side of the patient, and right now it's on the right side, so we need to change the slide as well.
Yes. Thank you, Cornelia.
Next slide, please. So now unreasonable effect prabhav. Okay. So I will just recite this Sanskrit verse. Rasavirya vipakanam samanyam yatra lakshyate vishesha karmanam shaiva prabhavastasya saskrita. So in two different dravyas, in spite of the similarity, we will find number of substances which are having similar rasa virya vipak, that is similar taste, similar post digestive effect, similar potency. Still their actions are different. Okay, there are certain examples we will see that. So this difference in actions is said to be prabhav. Okay, there is no specific reasoning behind prabhav, and it is not therefore logical. So there are certain things in Ayurveda or even in the healing process. Some of you must be even into healing by different practices. There also, how we can explain these things, whatever is happening. So for that, in Ayurveda, we have this answer in the scriptures. That is the prabhav, that is the unreasonable effect. Okay, next slide, please. So see here, milk and ghee. So we can see, even though both milk and ghee, they have sweet taste, sweet post-digestive effect, and cold potency, milk reduces the digestive fire, that is Agni, but ghee, it increases the digestive fire. I will again explain. See, ghee and milk, they have similar taste, which is sweet, similar post-digestive effect, that is sweet, similar potency, that is cold. But when we drink milk, it has a decreasing effect on the Agni. Okay, it reduces the digestive fire. But when we eat ghee, it stimulates the digestive fire. It increases the digestive fire. So how we can explain this is by the concept of prabhav. That is the unreasonable effect. Understood? Next, even the next example will even explain better. Next. See here, the first example is of the herb shirish. The second we see turmeric. So the anti-poisonous property of shirish, the Albizia libec is the scientific name. So this herb shirish, which we can see in the picture, it has such kind of leaves and flowers. It has anti-poisonous property. Okay. And haridra, that is curcuma longa, Everybody knows this turmeric. So Shirish and Haridra, they are considered as anti-poisonous, one which reduces poisonous effects. And if we try to understand why turmeric is, anti-poisonous, or why Shirish particularly, the herb, it is excellent in reducing the poisonous effects. Why is it so? If we try to put a logical reasoning, then we do not find it. And that is because this is the prabhav of this dravyas. This is the prabhav of Shirish. This is the prabhav of turmeric, that it has a anti-poisonous property. Okay. Next slide, please. And again, chanting of mantras and their effects on the body. Now we say that, certain mantras, whatever we say, the Sanskrit verses, or even any prayers or anything, in any religion, in every religion we can see, it has an effect on the body, mind, a very good effect on the body, mind, and soul, very calming effect. And what is the effect? What is happening? So again, this can be explained by the prabhav. So chanting of mantras and their effects on the body. The mantras can be in any language of any religion. Okay. The prabhav can explain that calming effect and the very good effect that the mantras have. Why we are explaining this to you? So that you understand even the minutest details in Ayurveda and Siddha Veda. Because here I will explain you one very important principle, which I always used to explain to the students where I taught in university, that in Ayurveda there is a siddhanta, there is a principle which says that the pratyaksham hi alpam, analpam apratyaksham. That means the things that we can actually see, hear, taste by the sensory organs, by direct observation, they are very less in number. But the things which cannot be perceived by the senses, by the eyes, by the ears, by the nose, like that, they are many in number. Means there are some things which cannot be directly observed, but they can be felt, and such things are in large quantity in the nature. This is a principle that has been explained by Acharya Charak in Charaka Samhita, which we should keep in mind, because this is the basic of healing science, which if we go deeper and try to understand, then we will understand. You just now think over this, whatever principle I have told you. Okay. Next slide, please. So we will just summarize what we have learned is the 6 tastes: the sweet, sour, salty, pungent, bitter, and astringent. The potency, that is the heating and cooling. The post-digestive effect, that is the 3 types: sweet, sour, and pungent. So, and the prabhav, just now we explained it, that is the unreasonable effect, where there cannot be any logical reasoning, but still there are results. There are certain dravyas, they act just by the prabhav. There is no, logical reasoning. They do the actions because it is the prabhav of that. And there is a description of such dravyas, which we will study ahead. Okay. Next slide, please. Yeah. So about the challenge activity, I think Cornelia, can you explain them? So before that, I will just tell you that this particular lecture, this particular session about Dravya, Rasa, Virya, Vipak, Prabha, why we are going into the details. We could have just switched over to the directly the herbal remedies, and you could have known that, these are the contents and this, but if you want to understand why this particular herb is having this action, this is the main principle. So that's why we have started with this. So read it twice, thrice, number of times, you will learn. Okay. So go through this lecture again and again and try to understand, write it down, make your own notes, read from the notes, and then you will be clear, so that for the further lectures, you will be ready. Okay. So yes, Cornelia, please, you can go.
Yes. This slide, thank you very much, first of all, Dr. Kamal, for this very interesting lecture again on the different properties of the herbs, or actually also the foods that we can always examine. And our first challenge activities for the falls series of our lectures is actually to select 5 kitchen herbs and list the rasa, virya, and vipaka of each of the herbs, and really use the to understand why they have these potencies or the tastes, and then what is so just list them. And it's really interesting to do that. I've already done it, and as I knew what was coming. And so it's really interesting to do that, and so have fun with it. I guess that's all that we have today. And back to either Dr. Kamal or to Dr. Hemang.
Maybe, as Dr. Kamal explained one time, listening is not enough. So good to listen 2 or 3 times the same session. We will upload the same session on this portal tomorrow. So then you all can at least 1 or 2 more times listen it, watch it properly. Will be very helpful. Yes, Satu.
Yes, thank you. I would have 2 questions about this lecture, if I may. First of all, Dr. Kamal mentioned about the vipaka, how different tastes the rasas turn into 3 of these vipakas. So sweet and salty turn up to sweet, then sour, and what was the other taste that turned into sour?
Sour only turns into sour.
Only sour,
Only
okay.
sour.
And then pungent and
remaining 3 into pungent.
pungent, the rest of the 3.
But means pungent, bitter, and astringent, they turn
Right.
into pungent.
Yes,
This
thank
is
you.
a general rule, general, but you can find some of the exceptions here and there.
Okay, thank you. And the second question was about the study case presented here, about consuming a lot of curd and buttermilk. I understand that they are sour, but in many cases, it is recommended to consume buttermilk when there is a pitta-related imbalance. Why is that?
See, buttermilk even has different methods of preparing. Okay, the way it is prepared. When we just dilute it with more water, it should not be sour. So in that buttermilk only we can advise for pitta disorders. So again, there are types how it is prepared, but generally what the buttermilk people prepare, it contains less of water and more of that curd content, and that's why it becomes sour. That's why.
Okay.
So generally we do not advise that, because if we tell someone you drink buttermilk, so we are not sure how much water he is going to put. That's why it's better tell them to avoid that buttermilk, because we cannot go to there and check whether how much water they are putting and whether they are taking care of. So that's why it is like that.
Thank you very much.
May I ask there about the ghee, which is compared to the milk, more heating, which I understood as because it has more calories, that it heats up more. So in compared to the milk, and here I would think also that the buttermilk compared to the curds, because when buttermilk is diluted with water, has lesser calories compared to the curds. So the curds is heating more, whereas the buttermilk is more cooling if you have more water in it. So that's what I understood, that is then cooling. And then some people drink or that as for a cooling effect.
Yeah.
So just to kind of explain that to myself.
Yeah, right. You're going on the right track. Yes. Now I would just, first of all, before asking questions, I will just tell you one thing. Now don't go, this is my advice, huh? The way I want you to learn it in the best possible way, according to my experience. Don't go into why tomato, tell me the rasa of tomato and whatever pictures were there. Don't go into that. Right now, we have not entered that door. We are just at the entrance outside the door. Okay, still we have to enter inside. So don't go into the details ki why this is like that, because we are going to study. Only first understand what is the taste, what is the post-digestive effect, and what is the prabhav, and what is the potency. Don't go into what is the potency of this, what is the potency of that, because we have not started even. So just focus on learning the principles first, because there is now ample time. And after that, you yourself try to find out whatever pictures were given, what is the taste of that, what is the potency of that, rather than I answer it to you directly. So that way you will study better. This is my suggestion, because that way we learn better. So that is my suggestion to all of you.
Nusrat, you had a question, but I don't see you anymore.
Yes, I'm sorry, but there's a lot of noise at my home because people just arrived, so I don't want to disturb. In one of the slides where we speak about the 3 different types of substances, which can be medicines for healing, which can cause certain disorders or prevent occurrences of diseases. In which category would the Rasayana herbs go? In the 3rd class? Or it depends on each herb, the way they interact on the body?
In the 3rd one also, as well as to pacify also. Because Rasayan and this, they pacify also, and as well as they prevent also. So both the way, both the categories. Good.
Okay. Thank you.
Thank you, Nusrat. Then we
Thank you very much.
And then we have Helene next, and then Afsina.
Yes, I have a practical question. I don't know if it's part of this class or maybe the next, but to be very practical with the virya, is there a way to know, is that with the rasa that we see if that's cold or hot, or is that just an impression? Because the challenge activity is to find the 3 things with the herbs, and I was just wondering if there is a practical way that you do to find that out, the cold from hot.
Yeah. So see, if we are seeing the rasa, that is the taste, we will obviously by the tongue, we will taste it and then we will know. Now regarding the potency, how will you know whether it is hot or cold? Just see what action it does when it goes to the body, whether it has a cooling effect, whether it has a heating effect, whether, after eating something or some herb, we feel heavy or do we feel light. I like this. You just observe what the herb does to the body, the actions, and from that you can know whether it is cold or hot in potency. Okay, like that you have to observe. And then post-digestive effect, no need to go. If you do not find post-digestive effect, that is fine, because that is little difficult, but at least you can find out the taste and the potency. Okay.
Perfect, thank you.
And if you find the taste, as a general rule, whatever I told you right now, that sweet and salty, they have sweet post-digestive effect, like that you can guess. If it has a sweet taste, it will have sweet post-digestive effect. If it has say bitter taste, it will have pungent post-digestive effect, and so on. Like that you study. Okay.
And is there the same thing between rasa and virya? Like that the tables you can say between rasa and virya, the same thing? Is there something like this? Where sweet is always
no, it's not like that. Because there are also exceptions. So virya or potency actually should be known from the action on.
Okay, so no things. Perfect, thank you.
Great question, Helene. Afsina, and then Susie.
Thank you very much. I love this session. I have 2 questions. Just one I wanted to ask about Colmed. What taste is this and what is it used for? I've ordered 2 because I studied it somewhere, but I don't know what it's used for in, in Siddhartha. And my next question is about the potency of foods. In my country, we put foods in different categories based on potency. So for instance, if you're eating fish, they always use lemon juice or lime with fish because fish is cold and lime is hot in potency. So when you eat it, it balances it. Or like one day I ate potato. I boiled some potato with lots of garlic and coriander. And as soon as I ate it, after about 5 minutes, I started feeling very dizzy. So I'm assuming they were all very cold in potency. Am I correct?
Yeah. Yes. It can
So
be.
that is what you mean by notice the change in ourselves.
Yes. Exactly.
So when we eat something, we see how it feels.
Yeah.
But we also have 2 other potencies in Iran. We have cool and warm. Kind of balances.
You will study it gradually, just in the next sessions. You will just go to the details. Don't worry.
And Kalmek is used for what? Please.
Dr. Hemang, can you just answer that?
Kalmek,
according to Siddhaveda.
Yeah, Calmeg is good for, it works as an antiviral.
Obviously.
It is good. Yeah. It helps to strengthen the immunity. It is good for fever. Mainly we suggest.
How do I use this?
So normally we use in the, like one of the ingredient, it's there in the D-Viro tablet. So it's a part of that. Okay. So separately, normally we don't recommend to take it separately as a single herb as Calmeg. But I don't know if someone has recommended you, then.
No, I was watching an Indian program of Dr. Nara, and I was translating using Google Translate to translate what he was saying because he was speaking in Indian. And in that, he said to take Calmeg. So I quickly ordered to make something.
Maybe the mixture of something, the part of one of the ingredient in the formula, was it? Or maybe you can just send me the link. I will watch it.
I've lost. I cannot find that link anymore.
So normally it is for viral things, fever and certain like this. And if it is in the tablet form, still you can take like a one tablet powder.
It's powder. So, I can maybe put a little bit, like a half a teaspoon in hot water.
Yeah, hot water, and you take. It is, yeah.
See what happens?
Yes. No, nothing wrong. Yeah.
Thank you.
Yes,
Thank you,
welcome. Welcome.
Susie, and then Sanjay.
All right. So my question is for, and I asked it in the chat, but I don't think if it got noticed, is for the coma remedy, when you have the onions on the left and the milk on the right, is that cow milk organic and raw, or can we use the Western pasteurized milk, whole milk? Does it matter?
Normally in India, and so far what we have experienced here in India, it is with the normal cow milk. And but one time I was in Germany, Mannheim, and there was one client who was in the hospital in the coma from last like 11 days. And me and Dr. y1s13 there in Mannheim together went there, and we suggested the same remedy and some marma point and this ajwain, dry ginger powder, massage and all. And they used the almond milk. And after 11 days, the person was out of coma.
So they used the nut milk.
Almond milk.
Right, a nut milk. Okay.
Yeah, nut milk.
So And so your definition of normal cow milk, is that pasteurized or raw in India?
Yeah, it's a normal milk. Here it's a regular milk. Only one type of milk is available. We haven't
Okay.
tried or done any experiment with the different milks. So
Okay,
maybe,
because we have to have our
yeah,
milk pasteurized. That's a legal thing, right? So that's
yeah,
why I was asking. Okay, but that's awesome with the nut milk. That's amazing.
yeah.
Thank you.
That was,
I'm complete.
yeah, good. And that is something we need to correct. On the right side, it should be milk. Okay, right side
Did
of
I
the
not say
patient.
that? I thought it's the right
Right,
side. Right?
the right side of the patient's right side. The patient's head. Okay, patient is sleeping in the coma, and in the right side of the patient, it should be milk, and the left is the onion. The right is the milk. Okay, the right is the milk. Only
Thank you.
one thing to remember, so automatically another is clear.
I just wanted to say the packaged milk is always pasteurized. So packaged or bottled milk is always pasteurized. But otherwise you get it fresh from the cow. That's then not pasteurized.
True.
Just for answering Susie's kind of
Yes.
question.
Yeah. Good. Good. Daddy. Not.
Okay, Sanjay, and then Sienna.
Yeah, thanks for clarifying that photo. That was the question about left and right. That milk is on the right of the patient and onions is on the left of the patient. I was confused about that. The other clarification is for potatoes, the potency is cold. Is that right? To confirm.
Yes. Yes.
Okay, thank you. Yeah. Thanks.
Okay. Thank you, Sanjay. Then Sienna, and you are.
Okay, can you hear me? Hello?
Yes. Hello.
Yeah,
Okay. Yeah, thank you so much for the class. Sorry I can't put on my video because it's dark around here. So I know we've been given the homework to find ice kitchen head and list the rasta, and Vipaka.
Sienna,
My
we can hardly hear you. Can you change something in your settings for your audio, or go closer to the mic? We can hardly hear you.
Can you hear me now?
Yeah, much better. Thank you.
Okay, so my question is connected to Helen's question. So I just wanted to know if I will do the homework. I guess we will do the homework, but I just want to know if we have a table that shows the specific vipaka of each food. Because I don't want to guess, because I might not know what the vipaka is. Because right now, based on what I'm experiencing, most of the things I'm eating or consuming, I just feel hot in my tummy. So I don't want to make a mistake. So I just want to know, maybe in our next lesson, but I just need to know if Ayushakti or the lineage, if there's a specific table that shows the post-digestive effect of each food, so that if I see the table, I can work with it.
Yeah, good question. So always everyone has a different experience after eating. It's good that in the beginning, in this phase of the learning and understanding phase, to use the standard material, standard reference, standard definitions, and there is all like details available, like this potato is called, this is hot, this is like this sweet vipaka, this is pungent, this. So it's very specific with the reference that in the future, when we'll have some experience, then we can decide and understand accordingly more better.
Okay. Thank you so much. Then I also want to know, if because for some dosha types, they say eat food warm, like warm food. So I want to know if I warm food up or heat it up, if it will change the potency of the food in the digestive system. I want to know if it has any kind of change on the potency when you warm food or heat or eat food hot.
We normally recommend warm food to eat, not hot, first thing. Second, warm means cooked, and specifically for a vata condition, the warm is necessary, otherwise cooked more specifically. So the best thing is to eat cooked, boiled, steamed, soup, anything, instead of the raw. Raw is difficult and hard to digest, so we recommend to eat cooked, steamed, boiled in any form. So indirectly it is warm. But it won't like a change, or it won't affect to the potency. It has nothing to do with.
Thank you very much. Thank you.
You're welcome. Yeah.
Marie was next, and then Radu and Yasmin as well. Marie?
Yes, thank you. I'll keep it short. I want to say thanks to the doctors, Dr. Himang, Dr. Kamal. And Dr. Kamal, when you sing the mantra in the beginning of the session, it's always a great pleasure and blessing. And I like this word prabhav for those things we can't measure and don't see, because there's much to learn and we have to do our utmost. But for me, that is such a very special part that it is mentioned. And I want to emphasize the need to my colleague students not to forget their mantra, their praying before any treatment. For me, it is such a great help. You have a lot of things that you can apply, like one of the ladies had it, Lady Pilar, about the good having the herbs. Sometimes you don't have anything, and still you have everything in yourself, your voice to guide the person through a difficult moment. And more, your voice guided by the forces is so important. Thank you. Thank you for every time you sing the mantras and all those other lessons, because that is really important. I will not work without saying mantras and prayers for guidance. Ask the Jivaka lineage, help me. Today I have this and that to offer, but let me make the right choice. And you become stronger and more, how do you say it, more confidence. Thank you. That's what I wanted to add.
Thank you. Thank you.
Okay, Radu, and then Yasmin.
Everyone, I would like to ask Dr. Hamang, also related to milk and onion. Could milk and onion, when applied to a patient, left and right, could we put it away from it, or it should be close? Because I had a situation like that when we hadn't had a
within the 1 meter of the distance, 1 meter up from the head.
Okay, 1 meter.
Within the 1 meter.
Thank you very much. Thank you.
Yasmin?
Hi everyone. Thank you, Dr. Hemant and Dr. Komal for today's session. Very, very helpful. I have two questions, but I think I'll maybe ask one question because of the time. My question is also around onion and this treatment, onion and milk. So would it be possible for you to explain, I mean, how does it work? I know Dr. Komal mentioned about prabhav of certain substances. So just trying to understand how it works. And for example, if onions were on the right-hand side and milk on the left side, would that change the treatment or the outcome? So if you can please say something around that, please. Thank you.
Good question. Interesting question, but difficult to answer. Okay. Few things are difficult and there is no answer for, no explanation for. It is as it is. Like we are experiencing the heat from the sun. It is because the prabhav. Why the 6 times each Burma to press? Because it is been said.
Okay.
Why it is like this? And for few things there is no answer. Like we'll understand the definition or meaning of the prabhav in future.
Okay.
With the lessons, many many things are there which works. Okay. With the prabhava means there is no logic. If we look at, there are the some of the ingredients, herbs. If we think about the direct property, the ras, guna, virya, vipak, they should work differently. But because the prabhava, they work totally opposite. Why it is that? No answer. I give you one simple example of Arjuna. There is a one specific herb. Maybe many of you have heard about the Arjun. There is one of the good ingredient, one of the good herb plant for the heart, which is useful for the heart. If we look at its property, means taste, ras, gun, virya, vipak, it is not at all advisable for heart. But it works only because the prabhava, it is known as a special plant for the heart. It's a special remedy for the heart. Because the prabhava, power of the person, power of the plant, power of the presence. Sometimes some people presence makes a difference, prabhava. Okay. Not like this. So no understanding, no logic. And definitely it makes a big difference on the right and left. That is why I made a clarification that it should be like this. The right side milk, left side onion. There are the different use, different point, different possibilities.
Okay, thank you. Does prabhav mean behavior? Behavior of that substance. Yeah. Prabhav.
Prabhav is it works because it's a power.
It's a power. Okay. Okay. Power. Thank you. Okay. Thank you, Dr. Hemant. Yes. Thank you. Thanks. Okay.
Yes. And you can ask second question as well.
Can? Okay, thank you so much. So in Dr. Komal's presentation, it was mentioned, when we were looking at the different doshas, it said vata is vitiated by bitter, yeah, if I remember correctly. So I was just thinking about if somebody has vata dosha vitiated and they have diabetes, so they are usually asked to eat like karelas or anything bitter things. So is there a bit confusion or contradiction there, or are we okay to You know what I'm trying to say.
Yes,
So
yes.
if, yeah, thank you.
Yeah, that is a really nice question. Actually, when we say diabetes, according to Ayurveda, which we call as prameha, so there are again Vataj, Pittaj and Kafash types of that. So according to that, it is right that the bitter taste, it increases the Vata dosh. It vitiates the Vata dosh. So for Vataj Prameha, if it is Vataj Prameha, it is not advised. But if it is Kafash Prameha, it is advised. So again, this is a part which we are going to learn in the next year about the disorders and the various doshas types according to that. But what you are saying is right. If someone is having increased Vata dosh, and in that, if we give bitter, then definitely it will increase. So that is right.
Thank you. Thanks. Thank you.
Okay, thank you very much, Yasmin. Then we have again Helene, another question, and then Ilke.
Yes, I have another question, and it's very practical actually. I hope you can help or you have some insight for this. I've already done the thing with the herbs to try to see, okay, bitter, astringent, and what is the rasa. And I realized that there are some rasa that I cannot really distinguish. And I've seen that with the Healthy Me Detox, it's way better, thanks God. But I know, well, I don't know, the thought that comes that in India, you've grown up like with all the tastes, and there's just certain tastes for me, they're just not, I can't really distinguish, like bitter, astringent, they're very close for me, and pungent, it's okay certain time, but when they're together, it's kind of fuzzy, and I don't know if you have certain help, because I know I've seen in the internet where you can see the tongue and you can see, okay, sweet, you feel this, there you feel that, and but it was very frustrating, honestly. So I'm very curious to see after the Healthy Me Detox how it will be, this exercise. But if you have anything that you say, okay, no, this can help to for this exercise. If you have anything else, then just do it. And you're willing to share that would be, yeah, I would be grateful.
Means you want the like list of things which the rasa and everything is specified. Is that?
No, it's just for the practical, for the practice. When I take something in the mouth, to really be able to say, to distinguish and to say, oh, I feel bitter, or that feel astringent. Above all, between those two, really in the moment, in the practical way.
Okay, so next time what we'll do is share some examples of some food items which are having the 6 tastes. So you can just taste those food items which will be available in your place also. We will just try that. And in that way, then you can know that this is the taste, that astringent feels like this, like that. So you figure out what is available where you live and what are the 6 tastes. And then we can just think about that. Okay. Practically.
Okay, thank you.
Okay, Ilke.
Yeah, thank you, Dr. Kumar. I've just one comment regarding the prava, because my idea or my explanation is, like you said, on the one hand, we can use our senses and we feel or see or touch anything, but there's so much more. And maybe this is the explanation. All this energy around us, we don't really understand. We know it's there and it's a special kind of intelligence. And maybe this is this unreasonable, what something is happening in a positive way, but we don't know why. And for me, it's exactly this area. I don't understand, but I truly know there's something more and a higher intelligence which is guiding me or which is producing this effect. Maybe it's easier to understand it like this.
Yes, you're absolutely right. That is only the essence of that. Some things which cannot be explained, but still they have results, or sometimes, things can be felt. So that is everything that is under the concept of prabhav. Okay, like that. You're right.
We may call for God's power.
Okay, Afsina, you have another question?
Hi, thank you so much. Sorry. I just wanted to make one point about the onion and the milk. This was an experience I had with Dr. Giovanni. There was a lady who had an accident in my country, and she was not in coma. However, she became unconscious when she fell. And then after that, she wasn't unconscious, but she didn't have any energy to move at all. She could hear, but she was just really like as if she was unconscious. And Dr. Giovanni suggested the milk and the onion, as well as the ajwain and the ginger powder. I just thought I share that, and that helped a lot. So the person doesn't have to be in coma. They can just be unconscious and it will work. And that's number one. That's just because I experienced it with Dr. Giovanni. I thought I share. And Marie, you were talking about the mantra. When Dr. Smita came to UK, in the morning, we were doing the mantra with her. And the second day, I asked if I could record her as she's saying the mantra, so that I can do it when I see the clients, or when I'm doing Dara, or I'm doing, practicing posts. And she did. So after we did our mantra in the morning and prepared for the consultations in the afternoon, she did it and I've recorded it. So I'm going to post that in the 3-year group in the WhatsApp, so you can use it. I would advise strongly, before you touch a client, first, as Dr. Komal had taught people that went to India, to do the forgive and forget marma, and also do the forgive and forget between each client. Am I right, Dr. Komal? This is what Greta, darling Greta, had shared with me when she came back from India, and she came to visit me, and we were practicing the marmas and the dara. And also, so you do the forgive and forget between each client, but before you start in the morning, before you see or touch anyone, please listen and repeat if you can in your head, or just hear it with your hands like this in the namaste form, it as Dr. Smita says. It's amazing. It's an amazing mantra, and I'm very grateful. Thank you. Sorry for taking your time. I love you.
Yeah, thank you, Afsina. It is what I do every day in the daily routine. I'm not a good girl, but I won't work without prayer or a mantra. And what is so nice is that people get so used to your energy, and the communication without words is so good that when someone has been in surgery and they feel bad, they say, will you please do mantra? So they ask for it. And I see that you can clean your home and do the toilet and sweep and broom and vacuum and how do you say it, mop the house. But I always sing the mantra, the Dhanvantari mantra, as I was told when I did the Ayurvedic marma. So never touch and never do. So it is a rule for me. Thank you for telling us again.
I know you do, and I love you.
I love you too.
Good. That is like a kind of the culture that we start our day or practice or anything with the mantras, and that gives us like a good energy, good information. So it's good, not only in the beginning, but sometimes when there is a critical or complicated case and we find difficulty to understand or diagnosis, while taking pulse, also we think about the mantra, and then we get the information, solutions, guidance. Universe always help.
Yes.
Good. Thank you. It's a good practice. It's nice. Good. Wonderful. Good beginning. Good beginning. And still it is not complete. requesting again that please watch this video again, at least 1 or 2 times for sure. Maybe we'll have the many questions, or maybe you'll have many ideas, detailed understanding, which will be very, very helpful to understand the use of each and every remedies. Otherwise, that time we'll have a lot of challenges and difficulties. Good. So we'll see us again on 17th September. We'll have one Saturday break and then we'll be back.
Do we want to say I love you and I'm with you? Because I love you and I'm with you.
I love you and I'm with
Yes,
you.
I love you and with you.
I love you and I'm with you.
I
love you and
I
I'm
love
with
you and I'm with you.
I love you and I'm with you.
Love
Thank
you and
you.
with you.
I love you and I'm
Wonderful.
with you.
Thank you.
I love you and I'm with
Cornel.
you. Thank you.
I love you and I'm with you.
Love you and I'm with
Thank you.
Mwah.
Thank you, everyone.
Gratitude.
Thank you. Thank you. Thank you all.
Hello.
Hello. Nice. Thank you all. Thank you, everyone, for time.
Thank you.
Thank you. See you in 15 days, in 2 weeks again.
Alicia, give me a
Thank
call
you.
anytime.
Thank you. Bye.
Thank
bless.
you.
Love you, Nia Rika.